Yeah, and Elvis, just painting that picture of what it takes to come to Nairobi for treatment. That's what you were talking about,
Exactly.
Dr.
Patients are spending a lot of money, and you know, first of all, they are sick, so they are fragile. So our transport system also has its own challenges. The nights, in fact, when the night buses were there, so patients have come to Kenyatta. They have spent almost 12 hours, 16 hours in the night bus. They've not taken anything. Right. They are very sick. They're vomiting, and then they are supposed to get very strong medication the following day. They don't have money to do the test because they have spent it all on the road, traveling. So it's quite a big challenge. And so looking at what exactly should we do?
Yeah, because last year, if you recall, during the 100-day strike, these were some of the issues that you were talking about. Remind Kenyans watching today what you think the solutions are that you have been talking about for more than a year now.
Yeah, so the solutions are, as we talked about it, I think we have to revamp not just the health sector, but also the health service delivery. So then the health service delivery, there are just three components to the health service delivery. Issues of supplies and commodities and issues of human resource. So that even after that cancer patient has taken that painstaking journey to come to Kenyatta, at least that chemotherapy is available. And at least there is a doctor, there is a nurse that is specialized enough that they can give them that. There's a radiotherapy, there's a physicist, they can handle the machines and give that treatment, so that again they don't have to be in the queue for like another 8 hours, or they don't have to be waiting in a Kenyatta hospital bed paying 2,000 shillings per day for 2 weeks before they get the medication. That at least that blood is available to be given to them if they need it before the treatment. So the strengthening the health service delivery. And I think there's a little opportunity, there's a big opportunity, actually it's not a little opportunity. The president said that one of his big four agenda is universal health coverage. So if we are talking about universal health coverage, at least that should limit the financial burden. So if the government could find a way, and we have proposals and we have put this to the government before, of how to finance cancer screening and cancer treatment, because there are cancers that you should you can prevent them if you screen, like cervical cancer, which is the #2, but in Kenya here is #1. So if you just screen people for cervical cancer, for example, then you are able to catch all the cases and deal with them.
And so, we will talk about the universal healthcare plan in just a moment. We have 23 oncologists. How many do we need for Kenya's population? And progressively, how do we get to that ideal number?
So what we were talking about last year is a system in which we have an ongoing training, so that doctors go back to school and they are retrained on, they further their education, because for you to manage cancer properly, then you have to go back to school from being a general practitioner and then get a master's, and even further. People like Dr. Andrew, Dr. Carey, they have beyond their masters, you have to go and do another fellowship again. So we have to, and we have all of these cases. So we can actually build our training system in such a way that we are actually building capacity, so that we don't have 23 oncologists, so that we have at least 23 oncologists in every county, you know, because the cancers are there everywhere.
That's right.
They are everywhere, you know, and there are very many people, you know, like we are talking about 40,000 cases of cancer every year, but actually that is the number that comes to like Kenyatta National Hospital, or the number that goes to the hospital. There are several at the dispensary level, at the health center level, at level 3 that are never diagnosed, because there's no mechanism to diagnose them and there's no skills to diagnose them.
All right. So we'll talk about this a little bit more. Dr. Ouma Oluga, stay with me.
Thank you.
Because as he